Becca Boving is a pelvic health clinician with Orthopaedic Rehab specialist joining us today to talk about common pelvic conditions that people are dealing with and who should be coming in for treatment.
Yes, we get a wide variety ranging from pregnancy, postpartum, and then all the way into further adulthood issues with hip pain, back pain, pelvic pain, incontinence or the leaking, especially with like coughing or sneezing, or maybe the inability to make it to the bathroom once you feel like you have to go. So those are primarily what we see most.
And I know that you recently participated in the Women's Expo, the Women's Fair, I should say. I'm curious some of the issues that you found and what were people saying? What were people talking about?
Yeah, so the biggest thing is not realizing that they can have help for the coughing and the sneezing. Like that's one of the biggest, like, oh, that doesn't have to be my normal. And then a lot of times people are like, I've had back pain for this really long time and I also have some of these other issues. It's like, well, maybe the missing piece you need is the pelvic health side of things. So we'll treat them for that and then they can actually see results and sustained results.
So next month on March 13th on your Facebook page, you've got an online event called Stop the Leaks. Talk about that and what people can learn with that event.
Yeah, so Stop the Leaks is going to be online only, so you can watch it from the comfort of your own home. Don't have to be embarrassed about being there or anything like that. We're going to talk about all the reasons why you may be having the leaks or the inability to hold, and give you information and tips and tricks for what you can do to help in the future.
I find that, and I'm just assuming here, this is something that people don't necessarily want to talk about or even discuss with their doctors, but there is help available.
Yes, and I feel like I go in and speak to physicians all the time too, because sometimes there's that uncomfortable feeling within a patient and a physician, and I think we need to give that patient more comfort, so that way they know that when they come to see us, we're going to make them feel comfortable and a little more welcoming.
And it's common, right?
It's so common, so common.
But nobody talks about it because they're embarrassed too, right?
Exactly.
Yeah.
Yep.
And this is a quality of life issue that you're talking about. Why do you have to be worried about, oh, I better not laugh because I might wet my pants, right?
Yeah, absolutely. We see people like that all the time, or they're afraid to go out and have a social life.
And is it both women and men?
Women and men can experience this. I primarily only treat women.
Yeah.
Yeah, that makes sense. So again, you don't have to be embarrassed about it.
No.
This is so common, and people are probably, even your friends are probably not talking about it. Unless they're joking about it.
But I bet you're going to get people that say, I'm a little older, so this is just, this happens.
We get that all the time, but we have patients currently who are in their 60s, 70s, and we've even had somebody in their 80s.
Wow.
ORSMI.com for more information. Orthopedic Rehab Specialist. Thank you so much. Good information.
Thanks.